Welcome to the Economics of Anything talk show. Today, we will be joined by two professional economists to discuss the demand side and supply side economics of healthcare, a very essential but a very expensive topic in the United States. This is Victor the Viking, an experienced pirate. Welcome to the show, Victor.
Thanks for having me, but I prefer the terms trade specialist or expert negotiator. Pirate is a bit outdated. I am basically an economist.
Noted. I want to start off with a very important question here. What makes healthcare in the United States different from elsewhere?
I'm so glad you asked that question. Well, first of all, healthcare in the U.S. is heavily tied to employment. If you have a job, you likely have health coverage of some kind tied to your job, unless, of course, you're retired over the age of 65 or live below the poverty line.
Was it always this way?
No. Actually, healthcare started becoming tied to employment status after World War II. Following World War II, we had wage controls and employers started adding fringe benefits to make labor more attractive. In the 80s, hospitals went from being charters to being businesses, leading to a lack in transparency of prices and greater need for healthcare coverage. Plus, employers gained taxes exemptions for providing coverage. That is why people tend to stick to their one job that seems more valuable than it might be without health insurance.
What do you think would happen to the economy if we had free healthcare?
Well, I think it would be good for the economy. It would boost our aggregate demand.
How so?
See, right now employers spend a significant chunk of their gains on healthcare coverage. Data shows that even if employers had spent around 50% less on healthcare coverage or health insurance, workers would have taken home around $400 billion more. More money equals more spending, which shifts aggregate demand to the right.
But what if people wanted to leave their jobs?
Well, if healthcare is covered by the government, people are more free to leave their jobs because compensation doesn't tie them to employment anymore.
How is that going to affect the economy?
So people who don't like their jobs right now can move to other sectors and increase productivity there. Because people who are currently unsatisfied with their jobs are only employed there for insurance, it decreases overall productivity as they don't enjoy their work and do it as efficiently. However, if they are free to leave their job without the cost of giving up insurance, there could be more self-employment as well as small business openings.
How would this affect long-run growth?
So if there's more small businesses and self-employment, they can lead to new innovative ideas, which is essentially entrepreneurship. As we know, entrepreneurship is a factor of production, so it could boost long-run growth.
Many would actually argue that healthcare for all would drive aggregate demand down and lead to huge loss in jobs. What do you say to that?
That is true, but it's not the full picture. To fund free healthcare, we would obviously have to pay with taxes. That would cause an increase in taxes and would bring AD to the left. Jobs may be lost in the health insurance and billing sectors because of government takeover. However, that would be temporary. There will be a general increase in job availability because of new positions available in the government's initiative, and the jobs lost in the insurance and billing sectors are largely transferable to these new positions. There is predicted to be more job growth than negative effects of increased taxes. In the short run, private investment may be crowded out due to higher interest rates because of government spending, but that would most likely fix itself in the long run.
Well, there has to be some drawbacks to publicly funded healthcare, right?
Sure there are. It may be hard to determine prices if there is no competition between hospitals. This may also stunt innovation because there is no incentive or motivation for hospitals to do better. If hospitals decide that reimbursement is too low, they may sacrifice quality for the regulated price, or they may overstate their cost to the government and waste tax money. Plus, consumers might have less options to choose from when choosing their provider, and like we previously stated, health insurance companies could reach bankruptcy and employees would lose their jobs.
Do you suppose there's a solution that may avoid these issues?
I think the best situation here would be to keep the private sector and have some sort of price regulation. A very appealing solution would be the government reimburses the cost of medical expenses to patients after treatment at a chosen hospital. That way, the private sectors like insurance and competition between hospitals could remain.
We will discuss these topics in more detail after the break. Thank you for joining us, Victor.
Welcome to an engaging conversation unpacking the supply-side effects of free healthcare and its far-reaching impact on the economy. Today, our expert economist is here to guide us through the intricate dynamics, delving into concepts in the short-run aggregate supply. Let's dive right in. Mr. Langer, when we delve into free healthcare, how do the supply side dynamics come into play, particularly when considering healthcare providers?
Absolutely. On the supply side, the notion of free healthcare initiates a cascade of adjustments for providers. With an increased influx of patients due to heightened demand, providers must rapidly expand services and facilities, resembling the principles seen in short-run aggregate supply.
What about the financial incentives for healthcare professionals and facilities? How does the concept of free healthcare impact their economic landscape, possibly intersecting with SRAS principles?
The financial landscape undergoes a significant shift. In a system where the government takes the lead in payment, negotiations or reimbursement rates become pivotal economic factors, aligning with the negotiation dynamics inherent in SRAS. This process directly influences financial incentives for healthcare professionals and the overall viability of healthcare facilities.
Shifting to the healthcare workforce, how does the availability of free healthcare affect the labor supply and recruitment in the healthcare sector, potentially mirroring principles observed in SRAS?
On the supply side of the workforce, the allure of free healthcare tends to draw more individuals into healthcare careers, reflecting principles akin to the shift observed in SRAS. The perceived job stability and benefit act as motivating factors. However, managing and sustaining a skilled workforce becomes a challenge, with the rising demand echoing challenges seen in the SRAS scenarios.
Now exploring technological advancements, how might free healthcare influence innovation and adoption of new technologies from a supply-side perspective?
The supply side stands to benefit from increased resources in a system of free healthcare, mirroring principles guiding SRAS. This infusion can expedite innovation and the adoption of advanced technologies.
Budgetary implications are significant. What can you tell us about the impact of free healthcare on government budgets and expenditures, especially from the perspective of the suppliers?
From the supplier perspective, the impact is profound. Providing free healthcare places a substantial burden on government budgets, reflecting budgetary implications akin to those seen in SRAS. This dynamic potentially influences negotiation power and financial stability for healthcare providers. Depending on the price regulating practices of the government, quality may be compromised.
And what about the pharmaceutical and medical equipment industries? How might they be affected on the supply side by the provision of free healthcare?
On the supply side of these industries, negotiations on drug prices and the cost of medical supplies becomes paramount. The profitability and operations of pharmaceutical and medical equipment suppliers are directly influenced by the higher supply of medical equipment due to the demand rising.
Finally, in a system of free healthcare, how does government regulation on the supply side come into play?
Government regulation takes center stage in shaping the behavior of healthcare providers and suppliers, aligning with the regulatory influence seen in SRAS scenarios. The extent of regulatory impact becomes a key determinant of how efficiently the supply side responds to the challenges and opportunities presented by a system of free healthcare. Depending on price level and other factors like services provided and employment conditions posed by the government, the supply side may not like the government's initiatives as it may limit profits.
Thank you for shedding light on the intricacies of the supply side effects of free healthcare, Mr. Linger. This conversation has provided us with valuable insights into the economic dimensions at play, particularly when considering concepts like SRAS.
My pleasure. Always intriguing to discuss the current or future economy. Speaking of current, how about you get rid of those 200-year-old monocles and buy yourself some new tech, highly fashionable glasses?